Hello class, today I will be talking about the 3 misconceptions of diabetes. Going into the medical field, I feel it's very important to know about diabetes and how to handle patients that have diabetes. So many people develop diabetes. There are 2 types of diabetes, the type 1 and type 2, which I'll be talking about later on in my presentation. Being a diabetic isn't the end of the world. You can still live an active lifestyle just like any other person. Knowing is very important. Knowing and reading facts. Knowledge. Knowledge is power. These studies were found by the Joslin Diabetic Center in Boston, Massachusetts, where they do clinical care, clinical research, health and wellness programs. This center was founded by Elliot P. Joslin. The center in 1968 emerges to be the Joslin Diabetic Center. The first misconception of diabetes I'll be talking about is diabetes is caused by eating too much sugar. This is false. Like I mentioned, there are 2 types of diabetes. Type 1 is when the pancreas completely stops making insulin, a hormone that helps the body use glucose, which is found in foods, for energy. Then it's type 2. This happens when the body does not produce insulin at all. Usually occurs for people who are 40 and overweight or hereditary. The exact cause of the diabetes is not known. Researchers suspect it's the environment or genetics. And sometimes when you're pregnant, you become a diabetic. And then it goes away and then it comes back again if you become pregnant again. Not sure why. So that's why eating too much sugar doesn't cause diabetes, because there are so many factors that can cause diabetes. The second misconception of diabetes is you can't live an active lifestyle. This is false. You can live an active lifestyle. You can run, walk, you can swim, you can do anything a regular person does. You don't have to stop living just because you have diabetes. As long as you consult your physician, because they know more about your condition than you do. So make sure you consult your physician before you do any of those programs. They prefer you to do exercise program anyway to keep their diabetes under control. And the last misconception of diabetes is injecting insulin is painful. This is false. If you inject yourself, you won't very good. If you know how to inject yourself, then it won't be painful. Both of my parents have diabetes. My mom uses an insulin shot, and she has to inject herself twice a day. So that's why it's important. When using a syringe, and this is what a syringe looks like. Everybody know what a syringe looks like? First, I'm going to demonstrate how you're supposed to use an insulin needle. You wipe your area. You can do this in your stomach. You can do this in your arm. You can do this anywhere. Make sure you use your alcohol wipe, rub the area. Then you're going to use pinch yourself, just like that, about 2 to 3 inches is good. And make sure you inject to a 90-degree angle and inject yourself very slowly. And make sure you continue pinching yourself while you're injecting your needle in your arm. Because you want to make sure that you get a good pinch. So keep pinching yourself, inject your needle, and put it in slowly, and make sure you have your arm still pinched. And then, like I say, you're going to go into 90-degree angle and push the syringe down and pull it very slowly. And that's all you do. So, and then you're going to do this, every day, because it's usually twice a day. And You can, if you know, if you start bleeding or whatever, just cover it up with a Band-Aid. That's it. And I've learned this. I've seen my mother do it many, many, many times. So I kind of know how she does it. So learning and knowledge is power. If you have any questions or anything, you can consult your physician. They can show you a better way. If the needle is too big, they can give you a thinner needle, and it will help you to do your insulin shots easier. There's a pen, and then there's a needle, and then there are pills. So my mother, she is type 2, so she has to take her insulin shot. So the body doesn't produce enough insulin. That's why she has to do insulin shots. So all these misconceptions about diabetes isn't true. That's why you have to read and understand and ask questions. Ask your physician. They know a lot about diabetes. And you can't let diabetes control you. You have to control it. And sometimes, if you do good and you take your medicine and everything, then you don't have to, your diabetes will go away. I've heard that as well. So make sure that you take care of yourself. Knowledge is power. And make sure that you take your medicine, and make sure you just keep active and go to the doctor, and you'll be fine. And thank you very much.